Hello, my name is Sharon, and this is Melita.
Hello.
What's your name?
Ganyet.
Ganyat. How are you today?
I'm fine, thank you.
Welcome to CELBAN. This is a test of language proficiency for nurses. In this test, we are assessing your language and communication skills, not your clinical knowledge. We are going to record your test in case we need to listen to it later. Is that all right with you?
Yes, it is.
Good. Do you have any questions before we begin?
No, I don't.
Okay. This is CELBAN ID number T01567. Today is March 5th, 2020. And the assessors are Sharon, Tanda Bibiana, and Melita Vakella. Ganyat, how long have you been in Canada?
I have been in Canada for 1 year.
1 year, okay. And where did you live before you came to Canada?
I lived in Finland.
In Finland, wow. What city do you live in now?
I live in Mississauga now.
Do you like it?
I love it in Mississauga.
Okay. Are you working now or going to school?
No, I am not working now, but I'm preparing for my exams.
Great, thank you.
Now I'd like to hear more about the place you used to live. Could you tell us about it?
Okay, so I lived in Finland, and I lived in the capital city of Finland, which is Helsinki. I liked it in Helsinki while I was living there because they have good transport system there. They have a lot of community attractions, and also it's not so big as much as how it is in Canada now. So I really like that I can get by from place to place without having to like drive. Or I don't like driving. I like to take the train. So the train is right by my house. So I really like that they have good transport system, and I like that it's not such a big city, right. So I can get around pretty easily. So I really like that about Helsinki.
What is something that people do there for fun?
People during the summer, there's this in Finnish, I don't remember what it's called, but there's this like a boat race, like people they're on the boat and the river, and then maybe for the whole day, people like to really stay in there. And they are drinking, they are doing various things, but I don't participate in that, but I believe that people enjoy they enjoy that a lot. Yeah.
Thank you.
Yeah.
Now we are going to do 3 role plays. Do you know what a role play is?
Yes, I do.
Okay. In this role play, we act like we are in a nursing situation.
Okay.
In the first role play, you will be the nurse and the other assessor will be a patient. I'll read the instructions and you can follow along. You are a nurse in a clinic. The other assessor will be your patient. Your patient is visiting the clinic for the first time. Your task is to initiate the conversation, ask questions to gather patient information, and then conclude the interaction. In this role play, you do not need to make an assessment or write anything down. Remember, we are not testing your clinical knowledge, we are testing your language and communication skills. Please turn over the page. This is the patient intake form. You need to get information for each section of the form.
Okay.
Now you can review the form. If you have any questions, please ask. When you are ready, you can begin the role play with the other assessor.
Okay. Hello, my name is Ganyet. I'm a registered nurse attending to you today.
Okay.
How are you doing?
Well, not so great.
Okay. Before we start, can you please state your name for me?
Robin Patel.
Okay. And your date of birth?
March 3rd, 1961.
Okay, thank you. So you mentioned that you're not feeling so great?
I have a bad headache, and I've had it for a while.
Okay. I will just write a few things down in this form, and then I will get back to your symptoms. Is that okay?
Mm-hmm.
Okay. So can you please tell me your occupation?
I work in IT.
Okay. So the reason for visit is you have a pain you mentioned earlier?
Yeah, in my head.
Okay. So can you tell me more about this pain?
I've had it for about 4 days now.
Okay.
And it really isn't going away.
Okay. So have you used any medications?
I've tried Tylenol. It helps a bit.
Okay.
But that's why I'm here.
Did you try anything else?
No, but I'm taking it every 4 hours.
Okay, every time. Okay. Do you have any allergies?
Yes, I'm allergic to shrimp and to shellfish.
Okay. Do you take any medications prescribed?
Medications prescribed? No prescribed medications.
Over-the-counter medications?
Well, I'm taking Tylenol for the headache. I also sometimes take ibuprofen.
Okay. Why do you take ibuprofen?
Oh, for my arthritis.
Oh, okay, okay. So, do you take any herbal supplements or any herbal medicines? Any herbal medicines, like alternative medicines? Do you take that?
No, I don't.
No. Okay. So, I would like to ask you more questions. Is that okay with you? Okay. So, have you had any cancer?
No cancer.
Heart disease?
No.
Okay. Diabetes?
Diabetes? No.
Hypertension?
Oh, no.
Okay. So have you ever had any surgical procedures or hospitalization?
Yes, I have. I had carpal tunnel surgery.
Okay. And how did that go?
Oh, it went fine. It was a couple of years, 6 years now.
Okay.
And my right arm functions fine now.
Okay. So any other disease or any health issues you think I should know about?
Yes, I have mild osteoarthritis.
Okay. So you take ibuprofen for that, I believe you mentioned.
Sometimes.
Sometimes.
Yeah.
Okay. Okay, so I would like to ask more questions about your family history.
Okay.
So any family history of cancer?
Yes, my father.
Okay, so what kind of cancer is it?
He had bowel cancer.
Okay, and how did that go?
Well, he passed away. He died. He was 76.
I'm so sorry.
Thank you.
Yeah. And any heart disease family history?
No heart disease.
Okay, diabetes?
No.
Hypertension?
Hypertension, no.
Okay. Any other diseases or health issues in the family I need to know?
Well, yes. My older sister has arthritis as well.
Okay. Okay. Thank you. Now I'm going to proceed to ask you more questions about lifestyle issues. Is that okay?
Okay.
Okay. So do you take any caffeine?
Yes, coffee.
Okay, you drink coffee?
I drink coffee.
How many cups?
Oh, 1 cup in the morning.
In the morning,
Yeah.
every day. Okay. So any alcohol consumption?
Yes.
Okay. So do you mind telling me how often you take alcohol?
Well, I like my wine. I probably drink 5 glasses a week.
Per week. Okay. Thank you. Any smoking? Do you smoke?
No, I don't.
No. Okay. So how about your sleep habits? How do you?
It's okay. I sleep about 6 hours a night.
6 hours a night. Okay. So do you feel well rested when you wake up?
Well, I'm waking up at night recently.
You've been waking up at night?
Yeah.
Is this due to the headaches?
It could be.
It could be.
Yeah.
Okay. Any stresses recently that could be causing the sleep disruption?
No, works fine. Yeah.
Okay. Yeah, okay. So how about your diet? Do you have any dietary restrictions?
No, I don't. I just try to eat well.
Okay. Okay. So and exercise, do you do any form of exercise?
Well, not really.
Okay. Any walking or anything?
Yeah, I walk to the bus stop and I walk my dog.
Oh, that's good. For how long?
Well, she likes a good walk, about 20 minutes.
Oh, how often?
Once a day.
Once a day.
After work.
Oh, how many times a week?
Every day.
Oh,
after
that's pretty good also. Yeah, 20 minutes that's quite good.
Okay.
Okay, so this concludes this form I'm going to fill, and then I'm going to take this form and go meet the doctor, and we'll have a little bit of discussion, and then I'm going to get back to you to let you know how we're going to move forward.
Okay, thank you.
Okay. So in the meantime, are you comfortable? Do you want me to do anything for you before I go?
Oh, I'm fine. Thank you.
Okay. Thank you very much.
Thank you.
Okay.
So we've now finished the first role play. May I have the form back, please? Thank you.
So now we will go on to our next role play. In this role play, you will be the nurse and Melita will be a patient. I'll read the instructions and you can follow along. There you go. You are a nurse in a hospital. The other assessor will be your patient. Your patient is being discharged. Your task is to initiate the conversation, provide instructions, respond to questions and concerns, then conclude the interaction. In this role play, you must give the instructions in your own words, using the discharge summary as a guide. Remember, we are not testing your clinical knowledge. We are testing your language and communication skills. So please turn over the page. And this is a summary of the discharge instructions. You need to give these instructions to a patient who is leaving the hospital after medical rhinoplasty to repair their nose. Would you like me to explain what medical rhinoplasty is?
No, it's okay.
Okay. Now, there are 4 points that you need to explain to the patient. Now, you can review the discharge summary, and when you're ready, you may begin the role play. Melita will be your patient.
Hello,
Hi.
my name is Kenyat. I'll be the registered nurse attending to you today. How are you doing?
I'm very excited. I'm going home.
Oh, yes, I learned you've been discharged.
Great.
Yeah, that's great. So, do you have any pain right now?
I have a little bit of pain right now, yes.
Okay, and have you taken any medication now?
The nurse just brought me something, so
Okay.
hopefully it'll kick in.
Okay, so you're ready to go.
Yes.
Yeah, okay, that's great. So, I would like to go over some discharge instructions for you
Okay.
for when you get home, things that you can do about the surgical procedure that you just had.
All right.
Yeah. So the first point will be to try to keep your head raised while you're sleeping.
Does that mean I have to sleep sitting up? I like to sleep on my side.
Not necessarily. While on the bed, you can use some pillows to prop your head up, so you don't have to sit down to sleep, or you can still lie on the bed, but use some pillows to prop up your head for more comfort. How does that sound?
Well, is it really necessary?
Unfortunately, yes, it is. Due to the surgical procedure you've just had,
I see.
we want to heal quickly.
Okay.
We want it to heal quickly. So those are some of the discharge instructions for you.
All right then.
So ask any questions if you feel you need to, please. Okay. So the second point is try not to blow your nose at all.
What if I have a runny nose?
Yes, you can use some tissue to just clean up your nose, but try as much as possible not to blow your nose at all due to the surgery you've just had.
Right. And
Yes.
how would I do that?
Uh,
With the tissue, exactly.
If the nose is running, you can just insert you can put the tissue right by your nose, or just insert it to drain out the liquid there,
okay.
instead of blowing. And that should do it. It's just for a few days, and then you
Okay.
can go back to regular ways.
All right.
Yeah. Okay, so the third point is to be gentle when you brush your teeth. We don't want the nose to be moving around and not be in a particular position. You just had surgery. The stitches should be in place. We don't want anything making any shift in the nose.
Okay, so is it okay to use my electric toothbrush?
As far as if you're being really gentle, it should be okay.
Okay, that's great.
And the fourth point is to avoid strenuous exercises or activities. So because you just had a surgery, this is a big thing on the body. So we want the body to be in rest mode as much as possible until you are healed. So that's why we are saying to avoid this strenuous exercises.
But I need to do sit-ups every day. It's part of my routine.
That's understandable, yeah. But because of the surgery, as I mentioned earlier, it's important to avoid these exercises so that it doesn't undo what's been done. So after a few days, you should get back to your exercises as you've always done.
After a couple of days?
Yes.
I see. Is there anything else I need to know?
No, that's all the instruction I have for you. But if you have any question, you can ask me now before you're being discharged.
No, I understand.
Okay.
I'll try my best.
Okay.
Thank
Yeah.
you.
You're welcome. And one more thing, when you get home, if you need anything or you have any problems, please feel free to contact the clinic.
That's great. Thank you.
Yeah. You're welcome.
So we've now finished the second role play. May I have the discharge summary back, please? Thank you.
Thank you.
Now we will go on to our final role play. In this role play, you will be a nurse and Sharon is your colleague, a nurse at the same workplace. Sharon has a problem with a patient and thinks you can help. Your task is to listen, explore the problem together, and offer some suggestions and advice. Remember, we are not testing your clinical knowledge, we are testing your language and communication skills. You may begin by greeting your colleague, Sharon.
Hello, Sharon.
Hi, Kenyat.
How are you doing?
I'm okay. You?
I'm okay too.
Kenyat, I've been wanting to talk to you about one of my patients.
Okay.
She's been on antidepressants for a couple of years, and now she's decided to stop taking her pills. I'd like her to understand how important it is to discuss this with her doctor before making any changes.
Okay.
Do you have any suggestions?
Oh, why she refused to take the medications?
You know, she's convinced that the medication has caused her to gain weight,
Oh.
and she doesn't like being heavier.
Oh, okay, that's quite understandable. Yeah.
I'm not sure what to say to her.
Have you had any conversation with her at all?
Yeah.
And did you try to find out?
She just doesn't want to talk about this with her doctor. She agrees to continue to see a psychologist.
Okay.
Yeah.
How about any family members she has that she could, talk to?
Yeah, she's close to her family. Have you ever had a situation like this before?
I haven't had a situation like this, but if this were to happen to me, I would definitely do what you're doing. That's like consulting with other colleagues, which I think is very good. Yeah. You might try and ask the patient maybe if she would like to talk to her family members to see what they think about this issue, and then we can go from there. What do you think?
Yeah, I'll try that. Definitely. How else can I support her?
How about the psychologist? Do you think maybe we should explore that area also? That would be a good way because she's willing to talk to the psychologist. So maybe talking to the psychologist can open up more information about this issue.
Right. So encourage her to continue. Yeah, she's agreed to do that. Yeah.
And then maybe talking to the physician also and trying to explore other ways to change the medication or look for other ways to treat the patient
I think I should ask the doctor to change the meds?
Yeah, we can try that also.
Yeah.
And explain the patient's concerns to the doctor because we are patient advocates. So
yeah, that's true. It's so difficult for patients to cope with the side effects of these medications, isn't it?
Yeah, it's a difficult thing for them to go through. Yeah.
So thanks for talking this over with me. This was really helpful.
Yeah, I hope I've been a little bit of help. Yeah.
Thank you.
You're welcome.
Now we've completed the role plays, and we'd like to hear your thoughts and ideas on a health-related issue. Here is your topic. Recreational programs at community centers encourage healthy living. What kinds of programs are most likely to succeed in promoting healthy lifestyles?
Programs that are fun, programs that people enjoy to do. I believe programs that are not competitive. People want to just have fun. They don't really want to do things that are strenuous. So programs like maybe in the community center, something like swimming classes, volleyball, or badminton, which is fun, really fun, by the way.
Good.
Yeah, and even table tennis, things like that. I believe that people will want to do more. And also when the community comes together, when there's a community center and they have programs that people can come in and then they do it with their family. I believe people will want to do more of that compared to when it's just them or maybe by themselves. They don't want to go and do things by themselves. But when they have people around them, then I believe they...
And why do you think some people don't participate in recreational programs?
Lots of reasons. For example, lack of time. People are really busy. They are really busy. They have family. They have work. Some people have shift jobs. So it's difficult to find the time to go for these programs. And also lack of motivation, life stresses, laziness, procrastination. I believe things like this hinder people from moving forward and achieving goals.
Okay.
So,
what are some ways that community centers can attract participants?
that's a good question. By making activities free, because when things are free, people want to go for it. If people have to pay lots of money for activities, they'll be like, nope, I'm not going to pay for that, so they wouldn't go. But when they are free activities, I believe people will want to go for that.
Anything else, you think?
Also, when they have activities that bring people together, the community comes together, improves the quality of life of people. People will want to stay together, and it's going to be fun. After a hard day or hard week, and they know that at the community they have fun programs where they are going to see a lot of people, meet a lot of interesting people. I feel that people will be more interested in going for programs like this.
Right. Thank you.
Yeah, you're welcome.
So now we'd like to hear your opinion on another topic.
Okay.
Health experts are advising the Canadian government to ban junk food advertising aimed at children. Do you think a ban would make a difference?
Tricky question.
True.
Yeah, I believe it should make a little bit of difference. I'm going to use myself as an example. Is that okay? Okay. So before I used to think, advertisement didn't have any problems with on me. They don't have any effect on me. But now I realize that when I see things on TV and when I go to the store and I see the same thing, I'm thinking to myself, I saw this on TV, so I'm going to try it.
Yeah.
So if I didn't see this on TV, I wouldn't have thought that, okay, maybe I want to try it. But I now see that this advertisement has big effect on people, especially children.
So how do you think children, feel about the junk food advertising?
I think kids love it. Because when they see things on TV, then they want mommy to buy it for them, or daddy to buy it for them, or someone should buy it for them. I think kids love it, but for we, the parents, or for the caregivers, then it's not so great, because the kids see PJ Masks on TV, they go to the store, they are screaming they want PJ Masks. So I believe if there's a not complete ban, like partial, like reduction, maybe it's going to help reduce what's being instilled in the children's minds, so they don't. I think they should advertise more vegetables, fruits.
Okay.
Then,
Interesting idea.
yeah.
So could you compare attitudes towards junk food now and in the past?
I believe the attitude towards junk food now is more elaborate than in the past due to the increased use of social media. People are more exposed to information. For example, I come from Nigeria, and back in Nigeria, sometimes we don't have electricity. Yeah, and we don't have access to TV because there's no electricity. So we cannot watch TV and see any advertisements on TV because there's no electricity.
Right.
So there's nothing instilled in my mind that, okay, now I need to eat some junk food, or this junk food exists. I don't know that. But my kids, now they are here every time they watch the TV, they see these advertisements, and they say, okay, mommy, we know PJ Masks, we know all these kind of cartoons and things like that. So there's increased awareness to all this junk food now due to the presence of social media, TV, electricity. Things have changed now. So now I believe that people have more access to junk food compared to in the past.
Thank you. I don't think I have any other questions. Do you?
No.
So now we have completed the speaking test. Thank you for sharing your thoughts and ideas with us. Please keep the test confidential. This helps make the test fair for everyone. It was nice meeting you. Have a nice day.
Thank you very much.